Greetings and welcome to today's Healthcare Provider Program brought to you by Living Beyond Breast Cancer. At this time, all participants are in a listen-only mode. This webinar is being recorded. I would now like to turn the program over to your host, Stephanie Washburn.
Hello, everyone, and welcome to today's Healthcare Provider Program, discussing breast cancer with kids, creating a roadmap with your patients. We're glad you could join us. My name is Stephanie Washburn, and I'm the Manager of Healthcare Provider Outreach at Living Beyond Breast Cancer, or LBBC, a national nonprofit organization that offers trusted information and a community of support to people affected by breast cancer. This program is part of our Young Women's Initiative, which provides resources tailored to meet the needs of women diagnosed with breast cancer under age 45. The Young Women's Initiative began in 2011 when we were awarded a cooperative agreement with the Centers for Disease Control and Prevention to expand our programs for young women. This funding continues today. A focus of the Young Women's Initiative is engagement and education of oncology navigators as well as other providers about the unique needs of young women impacted by breast cancer. We're pleased to have partnered with the National Navigation Roundtable to bring you today's program. The National Navigation Roundtable, a coalition of over 100 member organizations and individuals led by the American Cancer Society, is dedicated to achieving health equity and access to quality care across the cancer continuum through effective patient navigation. I'd like to thank the many people at the National Navigation Roundtable and the American Cancer Society who helped make this program possible. Regardless of role or title, we recognize that many types of healthcare providers have a hand in navigating young breast cancer patients and supporting them as parents. Our moderator and panelists will share their insights about parenting after a breast cancer diagnosis, as well as how providers can guide patients in having open and supportive discussions with their kids. We thank our moderator, Jean Hartford-Todd, and our panelists for sharing their time and expertise with us today. We'd like to draw your attention to several resources that we hope will be helpful, including information from the American Cancer Society about helping children when a family member has cancer, resources from LBBC about parenting and our Reading for Reassurance program, which offers free, age-appropriate books for kids about the impact of breast cancer, and a resource roadmap that includes recommendations from our moderator and panelists about discussing cancer with kids. You'll receive links to these resources by email right after the program. Today, we'll be using the Q&A feature at the bottom of your screen. Please submit questions at any time. We will respond to as many as possible after the panel discussion. To use closed captioning, please click the up arrow button next to closed caption on the bottom of your screen. Then click Show Subtitles to start displaying the captions. We will be emailing you an evaluation after the program. Your feedback is very important to us in planning future webinars. While we are not able to offer CEs for this program, participants can request a certificate of participation through the evaluation process. To receive a certificate, you must participate in the entire live webinar and complete the evaluation by September 28th. Certificates will be emailed by October 26th. I'd like to note that the speaker's views do not necessarily represent those of the National Navigation Roundtable, the American Cancer Society, LBBC, or the Centers for Disease Control and Prevention. We are recording the program and will post it on lbbc.org in about a week. This program will address best practices for talking with kids about breast cancer, how different types of parenting relationships, family structures, and cultural and ethnic beliefs may impact discussions about breast cancer, different needs across ages, developmental stages, and life experiences, groups disproportionately affected by disparities in parenting experiences, and resources to support patients and their children. It's now my pleasure to introduce our moderator, Jean Hartford-Todd. Jean has been a child life specialist at the Duke Cancer Institute in North Carolina for over 36 years. She started at Duke in 1986 and in 1996 began working with adult neuro-oncology patients focusing on the needs of children and teens who have a parent with brain cancer. In 2013, Jean joined the Duke Cancer Patient Support Program, where she offers psychoeducational support services to adult oncology patients to address the needs of children and teens in the family. It's also my pleasure to introduce you to our panelists. You'll learn more about them a little later in the program. Our parent panelists are Rivka Coleman, who was diagnosed in 2020 and is the founder of Love Her More, and Tony Willis, an LBBC Hear My Voice advocate who was diagnosed in 2013 and 2015. Our navigator panelists are Emily Beard, program coordinator at Northside Hospital Cancer Institute, and Melanite Fifita, research associate and patient navigator at the University of California, Irvine. We know you'll learn a lot from Jean, Rivka, Tony, Emily, and Melanite through their insights and experiences. At this time, I'd like to welcome Jean and invite her to join us on screen. Jean, I'll now turn things over to you.
Thank you so much, Stephanie. It is a pleasure to be here with you and with the panelists, and I really look forward to this hour. I'd like to start by sharing just a very few slides to discuss what it is like for families with young children or teens who are experiencing a cancer illness. And this slide, you can always rely on the New Yorker for a good slide. This shares, I think, so clearly how stuck parents can feel when it comes to discussing difficult topics. When this father tells his daughter that her goldfish ran away, rather than explaining that the goldfish died. And many parents feel the same feeling stuck when they need to talk to their children about cancer. So I'd like to start by talking about the context of families facing serious illness, what it is like. Some of these ideas here pertain to any family dealing with cancer, but some are more specific to families with young children. Certainly living with uncertainty and fear of the future and the unknown is very frightening. Role changes in the family, and specifically when I think about children and teens, I think about, the parent who always helped with homework is now ill, and the other parent is being the caregiver, working to maintain insurance, being the primary parent, and there can be so many changes that it's hard for the kids and the family to find a more settled routine. Even routines like bedtime, who's getting the kids off to school can be disrupted. Family rules can be disrupted where parents just feel so overwhelmed that they don't enforce their regular family rules. And one thing I always say to families is keep your family rules in place, but then make exceptions when needed. That's a very different message for kids than just sort of throwing your hands up in the air and abandoning your family rules or routines or structure completely. As we see in many families experiencing a serious illness, the illness experience is different for every member of the family. And families with very young children are impacted different than families with teens, families with one children differently than families with many children. Families have to deal with unfamiliar terminology, medical centers, traveling distances to get their treatment. And we'll talk later about how parents can clarify some of that terminology for the children and teens. Of course, financial and work stressors are present. And families react differently to support from the community. I've talked to families who say, oh, it's amazing. Every time I go to the grocery store, 5 people come up and ask me how I'm doing. And the very next patient I talk to will say, I don't go to the grocery store anymore because every time I go, 5 different people come up and ask me how I'm doing. And so that support from community versus attention from community can feel very different to different families. And then we're going to look at some of the barriers parents feel when they think about talking to their children about a cancer diagnosis. And of course, many parents are afraid that they will cry in front of their children. And while it is helpful if they can manage their most intense emotional reactions and have those someplace else, it really is okay for parents to cry with their children and to put words to their tears. Kids will be very worried if they don't explain why they're crying, that, you know, having cancer and getting medicine and all the changes it brings to family life can be difficult. Parents don't want to scare their children, and they often think if I don't tell them, they won't be scared, not appreciating that the kids are picking up on something significant happening. They think their kids won't understand. And often, as you see the further bullet, if the parent doesn't quite understand what cancer is and all these new words, it's really hard to explain it to the children. They don't want their children to have to worry when they're so young. And then parents will sometimes say they don't even notice anything's going on. They're in their own world, which for the majority of the time is not true. Some parents are inclined to talk to their children and explain they have cancer and answer all their questions, but suddenly family members are saying, you're not going to tell them it's cancer, are you? And they start to question themselves. Parents will think they're protecting the child when they're actually needing to protect themselves. It is really hard to open yourself up to a young child and sort of be at their mercy. And you have to talk about the cancer whenever they want to, even if it's in a very loud voice in the grocery store aisle. And so some of it is self-protection that I try to help parents identify and then work with and around. Something I see frequently is protecting the youngest child and giving them significantly less information than the older children, even if they're old enough to understand and hear more. And of course, the word cancer for so many people is connected to worries about death. And so it's hard for people to imagine that they can have conversations about cancer that do include death at some points, but there's so much more to talk about when it comes to cancer with the children. And then parents often don't know when to tell the children. When is the best time to disclose this news? And a primary struggle is they don't know what words to use. They just don't know how to do it. And so we're going to start our panel discussion hearing from our parent panelists first, and then our navigator panelists. But I would like to ask all panelists to come on screen at this point and introduce yourselves. And if I could, Rivka, I'll start with you. Would you please share how old you were when you were diagnosed, how old you are now, the stage of your cancer when you were diagnosed, and your current stage, and then your children's ages at the time of diagnosis and their current ages.
Okay.
Thank you.
Hi, I am Rivka Coleman. I was 37 when I was initially diagnosed, just at the start of the pandemic. I was diagnosed with stage 2A triple negative breast cancer, and nearly 500 days of active treatment consisting of many different systemic therapies. I'm currently NED, or no active disease, no evidence of disease, yay. We are a blended family of 8. So my husband and I have, 6 children. My children at the time of diagnosis were 18, 17, 16, 13, and 4. And then I have a 19-month-old baby at the time. I should have practiced that a little bit more fluid. There's so many of them. And then currently their ages, I have 3 in college, so 21, 20, and 19. A brand new driver as of yesterday, he turned 16. He's a sophomore in high school, a second grader, age 7, and my baby boy is now 4 in preschool.
Wonderful, thank you so much. Now, Tony, would you please introduce yourself?
Good afternoon. My name is Tony Willis, and I was 48 years old when I was diagnosed with stage 3 triple negative breast cancer. My boy-girl twins were 14 years old at the time of that diagnosis. I underwent treatment for a year, and in 2015, unfortunately, I was diagnosed with the metastatic recurrence to my left lung and lymph nodes. My kids were 16 years old at the age of that diagnosis, but I'm happy to report that I am no evidence of disease for the fourth time since 2015, and I've been on and off chemo since then. And they're currently 23 years old and college graduates as of Mother's Day.
23. Wow. Thank you so much, Tony. And then I'd like to introduce our navigator panelists. Emily, would you please share your past and present role as a navigator, the community or patients you serve, anything unique about your role, past or present, and the connection to guiding parents and talking with kids about cancer?
Sure. Thank you so much. Really pleased to be a part of this program. I am Emily Beard, and I am an oncology nurse by training. I've been working as a navigator in sort of the patient advocacy and cancer support space for more than 16 years now, and continue to wear a lot of hats. My professional role at Northside is as a program coordinator for breast cancer, but I am a community navigator and participate in lots of programs. I am particularly interested in working with young women, with young patients, their partners, families. I really love the dynamic kind of quality of that every patient is kind of going through their own journey and, helping them to connect with resources. And like so many healthcare providers, this is not something that I was really formally trained to do. So I've really learned through experience and observation and building a network of resources and support. I'm really grateful to have worked with wonderful colleagues and really, feel like programs like this and just continuing to build, my toolbox is really part of my experience as a navigator. And I've already learned so much from this group, and I continue to look forward to continuing to do that today in this conversation. So thank you so much. And I'm gonna think. Well, you're moderating, so I don't.
Yes.
I can.
Yeah. No. Thank you, Emily. I will hand it off. Thank you for helping. I will hand it off to Melanite. Please, if you would introduce yourself.
Emily's such a true navigator,
Yes.
always passing the torch. Malolole, greetings, everyone. I am Melanite Ficita. I am a staff research associate at the University of California, Irvine's Chow Family Comprehensive Cancer Center within the Office of Community Outreach and Engagement. I started as a patient navigator with my mother. She was diagnosed with stage 3 breast cancer in 2010. And like Emily, I built my relationships with first partnering within my family with my sister to navigate our mother because there was no materials in language for her. And then we partnered with faith-based organizations, and that led us to community-based organizations, which then led me to academic institutions. And so it is through the partnerships within the community that we have woven together to continue to navigate other Native Hawaiian and Pacific Islander women to seek health access, and that those women often deal with the same barriers that my mother dealt with. And so it's treating every patient as if it was navigating my mother. So I'm really honored to be a part of this discussion today. Thank you.
Wonderful. Thank you, Melanite. I'd like to start with our parent panelists. And Tony, if you don't mind, I'll start with you with this question, and then Rivka, I'll follow up with you with the same question. So Tony, how did you decide when and how you would tell your children about your cancer diagnosis?
Well, as you can imagine, after my husband and I got over the initial shock and awe of my diagnosis and knowing that I was definitely going to have to undergo chemotherapy with all of the wonderful things that come along with that, loss of hair, side effects. I had about 3 weeks from the initial diagnosis to the placement of my port. And my kids were finishing 6th grade. So they were transitioning to middle school. They were gonna be doing that during my treatment. So that's a pretty big deal. And as a parent with cancer, the last thing you wanna do is rock your child's world. So my husband and I discussed it. I consulted a book about talking to kids about serious illness, and at their stage, they felt that we, could divulge the diagnosis, to let them know that we had a plan, and to also engage them in helping out around the house and with me as I underwent my treatment. So we were kind of sneaky about it. My sister-in-law, who's also a cancer survivor, came to visit. I had my port placed on a Friday. It was the day that they went to Six Flags to celebrate the end of their sixth grade year. So we were kind of sneaky about it. We dropped them off. I went and had the port placed. And when they got home, I was home in bed, just told them that I wasn't feeling well. But the next day we did sit them down and I told them that I had breast cancer, that I had had a port placed and I would be starting chemotherapy the next week, and that we would need them to help around the house and to help with things that I, normally am responsible for. And it helped that we had my sister-in-law there. We told them that she had undergone cancer treatment and that she was doing well. So that was sort of a way of reassuring them. It didn't help that the week before they found out that one of their teachers had died from cancer. So we were very concerned about, that correlation. But anyway, they took it fairly well. My daughter actually said she thought we were going to announce we were having another baby. And her question was, am I going to get it? So she was a little concerned about that. But overall, they took it pretty well.
Wonderful. And it's interesting, kids will fantasize, whether it's over a week or two when they notice something's new and different going on, or just in the moments leading up to, we need to talk, they will fantasize a lot of things about what's going on. So it's great that you then moved forward and shared the news with them about the diagnosis. Thank you. Rivka, can you please share how you told your children how they responded and what you thought about when to do that?
So similarly to Tony, I also took some time, the first several weeks of testing and imaging, port placement and such. You can kind of hide, per se, the breast cancer diagnosis because I had no physical symptoms other than just a lump in my breast. And so, I was attending many more visits to the doctors and such than typical. So I think that was out of the norm, but kids are at school most of the day, so they didn't really notice. Since I have a very vast difference of age groups, we decided to kind of come together as a parental unit. I do have a blended family, so I involved, my children's father, my ex-husband, and said, what did his thoughts were on how to do it. For them specifically, they were a little bit older at the time, high school, late middle school, the two of them. And I thought it was appropriate to have us all together. So we decided to come together once we had all the facts, what we knew treatment was going to look like, what we knew, what was some of the side effects that I was going to experience, like hair loss, and really just give it to them, not tell them that the goldfish was running away, just kind of say, here's what what's going to happen. I am going to lose my hair. I am not going to feel well some days. We don't know how many days, but this is a potential. And like Tony, they were going to have to take up a little bit of that slack. We were just entering in the pandemic, so school became virtual during this time. Really watching me go through treatment, which was a lot more difficult for me to swallow as a parent, wanting to feel like the backbone. And so realizing that my husband is working outside of the home. I worked from home, but my oldest daughter had to take on more of my responsibility. I had, two small children that she was going to have to care for. She also became my caretaker. So when I had to get a shot 24 hours after chemotherapy, she had to learn how to give it to me. And at 17 years old, that is a lot of responsibility to put on your child. So really helping her understand how she could help out. My older children, like Tony, kind of were like, okay, we thought maybe there was something else going on here. Since I had a 19-month-old, they thought, well, maybe I was pregnant, maybe I was having another baby, but they took it relatively well. Telling my younger children was more of a challenge. My baby was weaning. He was only 19 months old. My little girl during this process had just turned 5. So she was 4 when I was first diagnosed, but by the time we told her she had just turned 5, she was still in preschool. Her world was changing too because of the pandemic world that we were entering. And so we consulted some books. LBBC has some fabulous resources. And so we were lucky enough to find this, stumble upon it during my first initial weeks of being diagnosed. And we sat down and kind of read some books and helped her understand what mommy was going to look like, you know, without hair, and how I wasn't going to feel well, and how I may not be able to always tuck her in at night because I might need to be tucked in. And so my little boy, my biggest concern was that he was not going to recognize me because I'm his mom and I had long hair, and my hair came back a different color, and, you know, he wasn't going to recognize me. So the biggest thing was making sure that I had more hats on, and so that he could just see my eyes. And so letting him see me initially, how I was and who I was the biggest thing. Letting him feel my face, letting him hear my voice, because I wasn't going to be able to breastfeed him anymore, and he wasn't going to be able to tug on my hair like he was used to. So just really trying to keep in mind the age differences.
Yeah, thank you so much. And you both spoke to sort of thinking through how you were going to tell your children. And one thing I encourage parents to do is think about the ages of your children, think about their personalities, and think about their coping, and then decide if you want to tell them all together as a group or individually. Because, you know, there's not just one right way to do it. It's what's right for your family. And my next question is, what was this experience like for each of you to tell your children this news? Tony, could I start with you?
Sure. It was definitely something that we thought long and hard about. I was happy that they took it well. One thing that I wish we had done is maybe have more follow-up discussions, because I've asked, my daughter since then. We kind of went over that whole experience, and, they could tell, for 3 weeks when I came home, I would just retreat back to my room. So, your kids know that something's going on. And in retrospect, after finding that out from her, they definitely knew that something was going on, but it helped that they were able to play a role in the process of helping out around the house. So.
Thank you. And parents find such comfort, I think, and tell me if I'm wrong, in waiting until you know your treatment plan to tell the kids, because it's not, oh, I have cancer and we don't know what we're going to do about it. It's, oh, I have cancer and this is what we're going to do about it. And so that can be a hard decision. Do I tell my kids? And I just encourage parents to stay tuned in like you were. You noticed your kids sensed something was up, and then you made the decision to wait for the treatment plan. And again, there's not one right way to do it. It's what's right for each family. Thank you. Rivka.
Process for me was very difficult. I'm a very emotional and person just naturally. So I express a lot of emotions. I'm usually very, very happy and go lucky. And I'm just an extrovert, social butterfly. So at that point, I was obviously in extreme shock, being 37, weaning a baby. I just was zero prepared for a serious illness like breast cancer diagnosis. So the shock was really intense. And so I was going through a really hard time personally through this, being a very healthy, exercise enthused person. And once that shock kind of wore off, months later, it took work, but I was able to follow up with my kids about it and say, how could I have done this differently? Not that I'm ever going to experience it, but I want to learn from it and hopefully help women, mothers coming after me. The biggest thing that I can say is that what I did was talk about it a lot. I did talk about it with my children consistently about what was happening next, how many I have left. They were an active participant in the shaving of my head process. They were an active participant in painting my nails. We used special things to keep my nails, preserve my nails, and they helped me pack my coolers the night before. So just keeping them involved at different levels based on their age groups. Also, I connected with their school counselors immediately. so many different schools to talk to, but to keep them tuned in. Hey, could you check in on my son? You know, he's going through this as well as I am going through it. And so just to allow them have boots on the ground and see him every day. So I feel like that, you know, really helped kind of just like full circle wraparound services, if you will, at home and at school, and just keeping everybody involved. You want to keep your personal business to yourself, but sometimes you need a village.
Mm-hmm. That is so true. And just being the parent and knowing who those important people are in your child's life. And it might be different people for your different children is so important. Rivka, you spoke a bit to how you kept your children engaged and sort of checked in with them. Tony, I'd love to ask you this one last question. Did you formally check in with your kids throughout your treatment and even since then, now at 23? Or was it a more casual, just chatting about it as it came up?
It was more of just a casual chatting about it when it came up. Actually, you know, when my metastatic recurrence occurred, that was a different situation. I waited a year after my treatment to do my prophylactic left mastectomy and DIP flap reconstruction. So during the pre-op, I knew my cancer liked to go to the lungs, so I requested a chest x-ray, and that's how it was diagnosed. But I had taken 3 weeks off from work for the surgery. We had family and friends lined up to come in and out of town. And so when I had the surgery canceled, we kind of waited. We went to MD Anderson. And so we were thinking, how are we going to tell the kids? Because that was really the more shocking issue. And so one day as they were coming home, my husband just kind of casually said, well, you know, mom's cancer came back, so she's not going to have her surgery. She's just going to, you know, go back to treatment. And so they really didn't know that it was stage 4 and the implications of all of that until many years later.
How did that more casual update feel to you? Did that feel comfortable? Did it seem to work for your children?
It did. It did. Yes. It did.
So an alternative is a more formal, we need to talk, but also just looking for the right moment, right? The right moment, the right time, the right location.
Right.
And
now
right
our follow-ups are more formal.
Yeah.
Yeah.
Okay. Yeah, they're so much older than they were. Yes.
And my daughter just graduated from nursing school, so she knows a lot more, you know, about all of these issues than they did when they were first, when I was
certainly. And sometimes when I'm working with parents who just really are stuck, I say, consider the possibility that you will just know when it's the right moment. Sometimes planning and picking a time and a location, it feels too, not the word, I can't think of the word I want to say, but it feels too fake, right? But as a parent, sometimes you just know when that moment descends and it's time and you can do it. So I talk to parents a lot about that. Thank you so much, Rivka and Tony. I'd love to move to Emily and Melanite and talk a little bit about this experience from your perspective as navigators. And I'll start with you, Emily. How do you and how have you over the years guided families around these conversations when parents have young children or teens? And what is your roadmap?
Well, thank you. You know, as I said before, I think I really try to just meet folks where they are because, you know, I think one of the things we have to remember is that, you know, everybody's family is defined differently and we can't make assumptions. So, you know, I try to casually, as a navigator, and it's really different, right? Like in the post-COVID world, because when I first started doing this work, I was, you know, at the hospital in the breast center, typically meeting people at that like almost immediate point of diagnosis, you know, and now so much of what navigators are doing is virtual, you know, is supporting people kind of from afar with resources and phone calls, and there may be some in-person check-ins, but I really like to think of navigators as sort of being anybody who touches the patient, you know, throughout the continuum. So whether it's a social worker or someone in the doctor's office or any of the healthcare providers. And I think my role is really, you know, to just casually try to get to know the family, like just to kind of find out, you know, maybe something like, you know, tell me about your kids, or, you know, how you can find out how old they are, what grades they're in, what are they interested in, you know, and I was not a parent when I first started doing this work yet, but I quickly learned from colleagues that, having some crayons and some paper around if the kids happen to be with the parent, just to kind of have something for them to do, or Legos, or, some little toys, not like a whole toy shop, but, a few things that you can have in your drawer to kind of just help engage them so that you can have a minute or two to chat with the mom or dad, or partner or grandparent or whoever may be there with them, about what they may need. So, I think that's kind of where I started. And then I just keep resources. I'm kind of a resource hoarder, if you will. Like, I keep lists of patients that people are willing, have told me that they're willing to speak to other folks that are diagnosed, resources, books, websites. The roadmap that you're going to be able to access is going to be a wonderful tool. And I encourage you all to download it and keep it with you, because I've just took a sneak peek at it and it's really wonderful. There's resources on there that I had never seen before. And I think it's just, a great way to kind of prepare. And then I just, try to really set the tone for parents to, like you mentioned, be vulnerable, just to not have to have all the answers, but to be willing to, tell their kids that this is something that we are going to deal with for a long time. It's not like something that you can just say, good night, and we check that off the list and we have the conversation and it's done. But this is a opportunity for like a long-term conversation. So that relationship, I think, is my main takeaway. I have now kids that, I sat coloring with when their moms were getting their diagnosis, who are in college, so it's really cool to see that progression, through time. So I think that's my roadmap, is to create a roadmap and to start developing your toolkit for patients, and also for us. I mean, I've learned so much about resiliency and just being a parent myself, never having had breast cancer, but from the patients that have allowed me to kind of walk alongside them, it's been really, really powerful. So.
And you touched on an important point. So many children are used to 7 days of antibiotics and the strep throat is gone. And so this concept of a parent getting treatment for months and maybe even more than a year, it's really hard for them to understand, and it can be confusing unless that's explained to them. Thank you, Emily.
You're welcome.
Melanite, I'd love to hear your thoughts on the same question, how you've guided families when there are children and teens and a mom has a cancer, or dad, I suppose, has a breast cancer diagnosis.
Thank you, Jean. So I have the perspective of being a young adult when my mother was diagnosed. So starting as a navigator, it's always from a patient perspective, a communal perspective. As I navigate Native Hawaiian and Pacific Islanders in Southern California, it's also creating a culturally appropriate space for them to be vulnerable and to feel safe. And so in having events in the community or doing wellness check-ins, it's always creating a space that's welcoming, not only for the patient, but it's always, you're not only navigating the patient, you're navigating the family and everyone that's connected to their network. And so it's always creating that welcoming space. That's been the greatest lesson for me, because there's still that stigma in our community that's associated to having cancer and being vulnerable to need help or ask for help. And many don't want to do that. So just starting with, here's a safe space of others who've been through that same process like you. When you're ready, reach out and we will come to talk to you about your journey and whatever your journey looks like. But when we get there, we're coming with all of our mana, all of our cultural energy, and creating that space. There'll be breakfast. We provide lunch. We'll have the elders come and they'll make there will be lei making and weaving. And then it's in those settings in which the families, and most times it's multi-generational households, in which the families come to this space. They'll have a breakfast together with us. And then it's through the cultural activities that we'll start talking story. And it could be with everyone from the youngest child all the way up to the elders, and how they feel as an individual dealing with the cancer journey, and then as a group, a collective, when they're all together. And it's just providing that open area for them to exchange energy. And then we can proceed as navigators with next steps. Okay, how can we take you from where you are to where you need to be. And not only just for you as a patient, but for the family as a whole.
Thank you so much, Melanite. You know, you spoke in your culture that it's hard to ask for help. And I've worked with families from cultures where talking about illness is considered inappropriate or that it would bring bad luck. And it's especially inappropriate to talk about the possibility of death. And when that happens, and I share ideas for maybe moving beyond that a little, and I just realize they're not going to. This is their life. This is their culture. I focus on maintaining a relationship with the hope that if it is a cancer where the parent doesn't survive, that in the final days and weeks, I have worked on the relationship enough to be able to step in and maybe at that point provide that support and help, even if I really wasn't able to impact discussions with the children earlier on. And I heard that from you too with the elders, and just really focusing on support and relationship building within the context of your culture. So thank you for sharing that. I think we have time for one more question with each of you, possibly more, but we'll start with this one. What are the most common concerns or worries? And I'm jumping down a little from what we had discussed, but what are the most common concerns or worries that the parents have expressed that you've worked with? And how did you support them around some of those most common worries? Emily, I'll start with you. Thank you.
Thanks. Yeah, I mean, I think that we mentioned it earlier. I think just that need to kind of have that routine and to disrupt, you know, kids having their routines disrupted. Also scaring, you know, just scaring them, having them be just fearful, you know, having to have that conversation about, while, you know, if you have early stage breast cancer, it may be not likely that you're facing death, but I think kids are smart, and I think we have to give them credit for being a whole lot smarter and more intuitive than we give them credit for sometimes. So a lot of times I'll find that kids will jump to that. They'll say, well, are you going to die? You know? And sometimes just having to face that horribly difficult question, you know, is really a lot for parents to manage. So, you know, I think reaching out, and so much of it is cultural, and so much of it is, you know, based on the family. I love that Rivka talked about her blended family, because, you know, these days we all have such, you know, like I said, dynamics that impact this. But I think the fear of disrupting, you know, also kids have, you know, concerns about how it's going to affect them. You know, am I still going to get to go on the vacation that we planned? Am I still going to get to have, you know, my friends spend the night on Friday night? And, you know, what I encourage folks to do is to lean into those kinds of experiences that you can control, so that the kids can continue. And maybe it's a good time to build that relationship with their friend and have that first spend the night, because it may be a great opportunity to get a little help and a little support from your village, you know, from your community. So, you know, that's one thing. Some people have, you know, concerns about like faith and, you know, their religious traditions. And so I encourage people to reach out to their faith leaders, you know, if they have a question that they really don't know how to answer in terms of that context. How do I explain that good things happen to bad things happen to good people? You know, if we believe that as part of our religion, that maybe that's not the case, or whatever the situation may be. So I think just having that space for those kinds of conversations is really important. And again, you know, to get to know the kids. I think kids, you know, with special needs, I'm thinking of a parent that I helped a few years ago whose son was nonverbal. And, you know, that was its own challenge. So she had to really get, you know, additional support for him in the form of, you know, therapy and counseling that was specific to his special needs. So, you know, helping parents find those resources that may not be readily available.
Yeah, thank you so much, Emily. And participants will have access to resources, the roadmap that was previously mentioned. And then there are 3 handouts, and one actually has, so often parents are told, well, be honest and use age-appropriate language to tell your children you have cancer. And parents are like, I don't know what that is. I don't know how to explain cancer. So one of the handouts actually shares ideas for possible conversations about what is cancer. And then also there are 3 suggested conversations about the possibility of death. And they're sort of at different levels depending on how ill the parent is or what the prognosis is. And it's really an individualized decision about how quickly you might move through those paragraphs. You might do all 3 in one sitting, or you might do those 3 over 2 years. But at least the language is provided where navigators, you can share that with your families and actually give them the words. There's also a handout. You mentioned counseling, Emily. Many parents wonder, should I get my child in counseling? So there's also a handout that addresses the questions around that. And the third just lists questions kids in different age groups have asked about cancer, just to see what they're thinking about. Melanite, would you please share your ideas and thoughts around what you've experienced that parents have worried about the most and how you've supported them around those worries?
Yes, the greatest that I've seen in the community is always starting with death. That's where they go to first. And that as a patient navigator, it's always reassuring them that we are navigators even through death. And so there's someone standing by you all the way through to provide you and your family support, no matter what will happen. But also the beauty is in reassuring that there's partnerships, that there's not only me as a navigator, but connected to me are these partnerships with community-based organizations that provide resources. Because right after there's the fear of death, and then there's what do we do next? There's the rush of what is even out there, or being overwhelmed with so much information and not knowing where to start. Yes. And so just meeting the patient at each stage to walk them through and say, okay, this is what we can do. This is who we're connected to get you the help that you need, and to help the children to understand what's happening within the family. And then also providing support for the family. And we can have wellness calls. And within the Pacific, we call it coconut wireless, that someone is always tapping into someone else, and someone always knows of another resource that can help the village, help the community as a whole. And so even though we experience these different barriers, there's so much resiliency within the community, and all we do as navigators is reach out and cast our net, and then the community always responds, and they're always reacting with, here's a resource, link them here. If it's faith-based, you can navigate them this way. And so we experience the burdens of there's the death, and then there's the death scare, and then there's shock. But once you provide them to the resources, you can see the calmness and the ease in what they are going through in their journey, and then walking them through. And if they need more resources of seeking mental health for the children, and they get to a point where they trust you and they share with you their most vulnerable feelings, we then can connect them and escalate their request to the appropriate physician that can help them, depending on where they are. So we do experience barriers, but as navigators, we are connected to so many partnerships and strong community champions that are always standing by to help. So always reassuring the patient that you're not in this journey by yourself, that there's others that have been on this journey before you and come out successful. And so we will do everything we can as navigators to get you to that point too.
Wonderful. And I think you have the benefit and the luxury of having that ongoing relationship, which is so important, and building the rapport. I would love to thank all our panelists today for sharing your time and your experiences and what you've learned over the years about supporting families when children and teens have a parent with cancer. I would like to share one last slide just to recap a bit what we've discussed, and also to touch on anything we might not have discussed. As I mentioned, it's so important to give parents the exact words that they might use to explain the cancer, and you will have access to some ideas for language to use in one of the handouts. And encouraging parents to say cancer versus sick, because they're afraid of the cancer word, but kids hear it, and it's best that they hear it from the parent in a private setting where they can have whatever reaction they need to have. And I realized I read my first bullet wrong. Asking parents for the exact words they use to explain the illness to children is important. I will ask parents, do your children know that you have cancer? And they'll say yes. And I'll say, do they know you're getting a port? Yes. Do they know you'll start chemo soon? Yes. And I'll say, can you tell me the exact words to explain this to your children? What did you say? And sometimes they'll say, well, I told them I'm sick and I'm going to get better. And that's it. And so really your starting place needs to be, what do the children know literally, word for word at this point? And encourage timely conversations so kids hear it from a parent before they hear it from someone else. Just be tuned into medical words that can be frightening or confusing. So IV, as in medical tubing, versus the IV that families have climbing up their wall. Dye, such as we're going to dye Easter eggs, versus dye when somebody's going to die. It's important to prepare the parent for the normal, healthy range of responses children might have to hearing the news of a cancer illness and to meet them where they are. And we've talked about that some today, where parents, you just did that intuitively, right? You met your children where they were. But letting parents know it's okay if your children cry, even if they cry hard, that is normal and healthy. Pause the conversation, hug them, explain treatment to them and what you're going to do about the cancer. Normalizing the right for children to have and teens to have and show feelings, and not always have this cheerleader environment at home, but letting them feel what they feel and show that. And we talked about giving kids updates in a timely manner, which, you all did so well, Rivka and Tony. And then I mentioned, if a parent is just really stuck, at least in our belief and understanding about talking about the illness, and you don't feel like you can make any inroads, then just continue to work on relationship building and building rapport with the family, so that maybe you can jump in and provide support when it's needed at a later time. So again, thank you to all of the panelists. It's been a pleasure to meet with you over the last few weeks and to work with you today. And I would like to invite Stephanie to come back and help us close.
All right, everybody. Thank you so much. You were all absolutely amazing, which I knew coming into this that you would be, and you exceeded kind of every expectation or thought. There are so many themes that came up listening to all of you. We actually still have some time for question and answer. I'm going to bring through some of the audience questions. So if everybody in our audience is able to stay with us till about 1, we'd love to have you stay for that. Some of the themes were compassion and love, support, connection, listening, community partnerships. There's just so much. So let's go on to some of these very thoughtful audience questions. And I really want to thank the audience too for being so engaged with us today. So we've got a few minutes. I'm going to do my best to get through the ones through as many as we can and try to direct one to each of you, because you all have so much to share. I'd like to hear a little bit more. Tony, this one was specifically for you. If you could just give us a sense of how you handled describing metastatic cancer to your kids.
Well, the same way I would describe it to anyone, you just have to explain to them that the cancer, traveled to another organ through the bloodstream or lymph nodes. And in my case, it was to the lungs and to the lymph node underneath my chest bone or my sternum. And just explain to them that, the treatment was the same, chemotherapy. We didn't really talk too much about what, the endpoint could potentially be. We kind of avoided that discussion, but now that they're 23 years old and, my daughter's, in nursing school or finished nursing school, and my son, was going through some of the same medical education, we are able to talk more about those specific details. So, I kind of gauged it based on what their knowledge base was at different stages.
Great. Thank you so much for sharing your experience with that. There was, I know this has been touched on a little bit, but I would throw this out perhaps to Jean or Emily or anybody else who has some insights, but there was a specific question As someone who is part of the medical staff, how would you have a conversation with a patient who is determined not to tell their children about their diagnosis? I know that's can be a really tough one to navigate. Emily, it sounds like you have something you want to add. Would you go ahead with that?
I was gonna punt it to Jean actually,
okay,
but
that's fine too.
But I will say, I mean, I've had this situation before, and I think just continuing to provide support, not to pressure the parent, but to, you know, just let them maybe, you know, let them know just that you're there as a resource. You know, again, I think so many of the reasons why they may not want to tell them are more to do with them, with the patient or the parent than with, you know, with the child's readiness. So I think just to, you know, give resources, but I think Jean certainly is the expert to answer this one.
No, thank you for adding to that, Emily. I do gently share with parents that if they disclose the cancer illness themselves to their children, that they can control when they tell their children, where they tell their children, is it in a private place or a public place, the message their children get, how they tell their children about their cancer experience. And if they don't, they give that control up. They give it up to what I call the grocery store encounter. And I talk to parents about this. It's when you're in the grocery store when you're with your kids and a friend or school parent barrels up to you and says, oh my gosh, I heard you had cancer. That's so horrible. My aunt had cancer and she blah, 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 blah. And there goes the aunt's story and the kids are just standing there. But some parents don't move forward with that type of support and information. And that, as Emily said, that's when I focus on building rapport and hoping that I can be available at a later date if the kids start asking questions or the illness takes a turn for the worse.
Great. Thank you so much, Jean, for sharing how you handle that based on all your experience. That's really, really helpful. So we have a couple more minutes. Rivka, I wondered if there's anything else you might share about your experience with your healthcare providers and talking with them about your kids' needs, your needs as a parent, just in as much as you did that. I think that might be really helpful for our providers on the call today.
Yeah, interestingly, I had a nurse navigator, had a plethora of oncologists who knew there was more than one type. I did not prior to my diagnosis in 2020, but it never one time came up. My husband and I are very upfront with how many children we have. Usually that's the first thing when people say, how are you? I'm like, busy. I have a busy home. It was never approached, not once. I was connected to multiple navigators because of the way the pathology is presented in a pandemic world is all over the phone. So I came in contact with many people. I had seen genetics already at that point. I had talked to radiologists. I had talked to 3 different types of oncologists at that point prior to us even discussing it, and never one time came up. So as I didn't even think to ask my medical professionals for assistance because it never came up in conversation. So, you know, we just took it upon ourselves and started doing some research, and it was very, very surprising to find out that that was something that my navigator potentially could have helped me with, or even a social worker, because I was granted access to a social worker. Very fortunate to be in a hospital that has one. My social worker did present me with some resources after, once we started connecting, but we never had that conversation. So.
Okay, well, thank you so much for sharing that. And I think that's really important for all of us to hear, and hopefully also provide some new opportunities for providers to think about the importance of connecting with patients really early in the experience about this important topic, even if the patients are not asking. And we know there's such a complexity and great amount of information that providers need to cover too, but that this one is also so important, of course, which is why we're all here today. So just before we wrap up, Melanite, I know you have a lot of experience in navigating, as I'm sure do many of the navigators and other providers on our call, but there also may be some where they're really new to navigation in oncology, and perhaps then also really new to working with parents who have a cancer diagnosis. And I wondered if, I know this is a big question, like to ask you to combine it all into 1 minute or whatever it might be, but any really key things that helped you when you were newer that you would want to pass on to a new navigator or another type of new healthcare provider working with parents and kids?
Yes, it is knowing that we will not have every answer. We don't know everything, and it's okay to go and ask anything you need because you're the advocate for the patient. And so oftentimes there's families that they'll confide in you of what's happening within their family, but when they get in front of the doctor, they'll say, no, I'm okay. I didn't experience that. And you as a navigator can gently say, well, remember when you were telling me that you were really hurt after you took that medication, or after treatment, you stayed in bed for 2 days and you couldn't move. Let's talk a little bit more about that. And so it's just, and there's a Tongan proverb, it's Piki Piki Hama, Kai Vai Vai Emanava. And it means, let us link our outriggers together so we can share life. And so I was taught that years ago by a mentor of mine, and it stuck with me in that no matter where you are in the waters of navigating, you can get there because there's other outriggers that are in the ocean with you that can help you get to where you need. So ask questions, don't be scared to ask, and cast the net. And when you cast it wide, you'll be so surprised and feel so loved even more to pass on that love from the community when they respond, and you pass that on to the patient.
Wow, that is incredible. I love that. It's really powerful. You're amazing. Thank you for sharing that. And I don't think we could move to wrapping up with a better sentiment. Thank you, Melanite, and thank you to everybody, our audience and our panelists, and Jean as our moderator. You've been amazing. So unfortunately, that is all the time we have for questions. So again, a special thanks to this amazing panel, Jean, Rivka, Tony, Emily, and Melanite, for your openness today and sharing your insights and your guidance. I know it can take some vulnerability to kind of put this all out there, and we really are grateful for that. I want to again thank the National Navigation Roundtable for their partnership and recognize the Centers for Disease Control and Prevention for their support of this program. As a reminder to our audience, you will receive an evaluation link shortly. Please remember to complete it for us no later than September 28th. We'll also place the link in the chat for anyone who'd like to do it now. That email that you'll get with the evaluation in just a couple of minutes will also include a link to the resource roadmap we've mentioned during the program. Please take a look and share it with your colleagues. We really hope it'll be helpful in your support of parents and their kids. For those of you who request a certificate of participation, you'll be emailed your certificate by October 26th. We will also be sending out a link to the program recording, Jean's slides, and Jean's handouts by about a week from now. So keep your eye out for that. So in closing, from Living Beyond Breast Cancer and the National Navigation Roundtable, thank you for participating in today's program and for the care you provide to people affected by breast cancer. We hope you'll join us for future programs. Please take care and enjoy the rest of your day.
This concludes today's program. You may disconnect at this time. Thank you for your participation.